This recording covers Chapter 18, which is about drugs. To start with just the definition of a drug is any substance that will affect the function of living things. Drugs can be obtained from plant sources, microorganisms, marine organisms, and other synthetic sources. These two pictures here, there's the Madagascar periwinkle, and from that, scientists have been able to derive anti-cancer agents. I also have a cone snail where scientists have been able to derive pain reliever from. So drugs can come from a variety of different sources. They aren't all just things that are created artificially in a lab. The first type of drug that we're going to talk about are NSAIDs. NSAIDs are non-steroidal anti-inflammatory drugs. As the name suggests, they relieve pain and inflammation, and they do so by blocking something called prostaglandins. So prostaglandins are little chemicals that are released from nerves in response to damaged tissue. The prostaglandin chemicals can cause pain and inflammation, but they also do good things because they help to recruit blood and nutrients to an injury site in order to promote healing. So when NSAIDs block those prostaglandin chemicals, they can affect the pain and inflammation, but they can also prevent blood clotting. And this is the whole premise behind the idea of taking low doses of aspirin daily to help prevent against heart attack and stroke, because if they are able to alleviate some blood clotting, then they can help prevent those conditions. Another thing that some NSAIDs are able to do is fever reduction. Fevers are caused by a compound called pyrogens. And we're not going to get into the specific nitty-gritty on exactly how this process works, but pyrogens often use those prostaglandin chemicals as secondary messengers. So pyrogens use prostaglandins, and since NSAIDs are able to block the production of prostaglandins, they can help to reduce the fever because they're reducing the amount of pyrogens that are around. So how do NSAIDs exactly work? Well, they block the production of prostaglandins through a very specific enzyme that's called a COX enzyme. And there's a few different types. Aspirin, ibuprofen, and naproxen, they all block both COX-1 and COX-2 enzymes. And as you can see from this slide, those two enzymes have different roles. The COX-1 enzyme has effects with both the stomach mucus and platelet stickiness, and that platelet stickiness is the blood clotting. COX-2, that plays a role in pain and inflammation. So aspirin, ibuprofen, and naproxen block both of those enzymes. So they have effects with pain and inflammation, but they also have secondary side effects with stomach mucus and blood clotting. Blocking that COX-1 enzyme can lead to some pretty severe side effects that include things like excessive bleeding and stomach pain. Some NSAIDs only block the COX-2 without the COX-1, so they don't have some of the same effects. Acetaminophen is an NSAID, but it acts slightly differently. It actually acts by blocking a COX-3 enzyme. So acetaminophen has the ability to reduce pain and fever, but it plays no role in swelling. So it does not have any anti-inflammatory effects, and it's also not an anticoagulant. So it's not going to play a role in blood clotting either. Acetaminophen can be taken by children and also those that are more affected by the side effects of aspirin. But it has been shown that in large doses it can cause liver and kidney damage, especially when taken with alcohol. Next up, we're going to talk about colds. So for colds, there are no effective cures, but there are a lot of medications out there that treat the symptoms. And periodically, the FDA will come through and they'll review these medications for both safety and effectiveness. So colds are caused by viruses, and there's more than 200 different types of cold viruses. And now, more than ever, is the time to mention that antibiotics are going to do nothing for a cold. So antibiotics are only going to treat bacterial infections. And since colds are viruses, antibiotics will not be effective at all for them. Some of the medications that are used to treat the symptoms of colds include things like antihistamines. Antihistamines work by blocking something called histamine. Histamine is a compound that your body will release in response to an allergen. Histamines, these little chemicals that your body is releasing, produces redness, swelling, and itching. So antihistamines block by preventing those histamines from causing that redness, swelling, and itching. Another medication that's used to treat the symptoms of cold are cough suppressants. The scientific name for that is antitussives. Oftentimes, those cough suppressants will include two narcotics, either codeine or dextromethorphan, or a combination of the two. Codeine is an opioid. It suppresses the cough reflex directly by affecting the cough reflex centers in the brain, and dextromethorphan actually works by numbing the stretch receptors in the throat, preventing cough. Another medication to treat colds are expectorants. Expectorants help to bring up mucus from the bronchial passage. It is important to note, though, that there's only one expectorant that has actually been shown to be effective by the FDA, and that's guanfacine. Decongestants are another drug. They are typically inhaled directly into the nasal passage, but they can be taken in pill form. They constrict blood supply, which helps reduce tissue swelling, which helps then to reduce mucus. Back up to the expectorants, one of the things I forgot to mention is that expectorants actually stimulate secretory glands in the body, helping to increase mucus production. So that's how those work. Another class of drug are narcotics. Narcotics are any type of drug that is shown to produce narcosis, which is defined as stupor or general anesthesia. Narcotics also include analgesics, which are painkillers. Narcotics are addictive, and because of that, they are regulated by law in the United States. Opium is a juice that comes from the unripe seeds of a poppy plant, and there's a lot of things that are in that juice. One of them is morphine. Morphine is about 20% the weight of opium, and morphine has been shown to be a pretty powerful pain reliever, but also can be quite addictive as well. Synthetic narcotics have been developed in order to try and produce something that has the pain relieving effects like morphine, but without the negative addictive like effects. Methadone is one drug, and it's been widely used to treat heroin addiction. Codeine is another derivative of morphine, and heroin is yet another derivative of morphine. One issue with heroin, though, is that the change in the structure actually made the heroin molecule less polar than morphine, which made it more soluble in fatty tissue, in the fatty brain tissue. So basically, another way to say that is that morphine is more effective at getting into the brain tissue than heroin is. You can see a list here of other synthetic narcotics, so things like oxycodone and fentanyl as well. So these are narcotics that were produced to try and find a compound that had similar pain relieving effects, though without the addictive effects. And you can see that's not always the case. A couple of terminology things to mention. Agonists are drugs that will mimic the activity of the natural compounds in the brain. So you can see in the first picture here, before drug, you've got the green compound that's binding to the receptor site and causing an action in the brain. The agonist drug is that blue compound. It's able to bind to the same place as the natural endogenous chemical and cause an effect in the brain. Antagonists will inhibit the action by blocking the receptors. So in the third picture there, you have the little orange hat-like things. Those are binding to the receptor and blocking the action of the natural compound. Naloxone is an antagonist. You may have heard of it or have seen Narcan is its other name, seen it mentioned in television shows, but essentially you can give someone that has overdosed or taken too much of some type of opiate, you can give them naloxone, and naloxone being an antagonist will kick everything out of the receptors. So it can help bring people out of their overdose by removing the drug from the receptors. I mentioned that the agonists mimic the natural compound for opiates, endorphins, are morphine-like chains that the body produces in response to pain. And though morphine and endorphins will bind to the same receptors in a brain. As a result, the endorphins will give a natural pain relief, causing something like a runner's high. Another class of drugs are antibacterial drugs. In the early 1900s, infectious disease were a leading cause of death in the United States. You can see the image is a little hard to read what they say, but the top picture is 1900, and you can see the first three. You have influenza, pneumonia, tuberculosis, and diarrhea being the top three. And then now, although this was 2011 and not current to our current state of the United States and the world, but heart disease and cancer were the leading causes of death in 2011. So antibacterial drugs have been helpful in leading the charge against these infectious diseases. A little bit of history on antibacterial drugs. Sulfa drugs were the first antibacterial drugs that were produced. Now there are a lot of different types of antibacterial drugs, and they have a lot of different ways that they will affect bacteria. You've got things like penicillins. Penicillins work by inhibiting enzymes that bacteria will use to make their cell walls. Cephalosporin, because you have a bunch of bacteria that are resistant to certain antibiotics, cephalosporins were reduced to replace penicillins. Tetracyclines, these prevent the bacteria from being able to make proteins in the body. So you got a lot of different bacterial drugs, antibacterial drugs, that affect the bacteria in a lot of different ways. Viruses are compounds that are made up of nucleic acids and proteins. And as I mentioned before, they cannot be cured by the use of antibiotics because they're viruses, not bacteria. And that last slide, I showed you all the different ways that these drugs can affect bacteria, but they can't do anything to viruses because they're not the same thing. There are some antiviral drugs that are effective against some viruses, but they don't provide cures. They really just help to lessen the severity. Next up are drugs to treat the heart. So we talked a couple of lectures ago about arteriosclerosis, that blocking of the coronary arteries because of too much cholesterol. That can lead to chest pain and ultimately heart attack. Some treatments for that include nitroglycerin. That can be used to treat the chest pain by relaxing blood vessels that have become constricted. There's actually a whole series of different types of drugs for the treatment of heart failure. You can see there are various different stages as far as being at risk of heart failure, and then in the stages of heart failure. The first stage, stage A, would just be you have high risk of heart failure, usually because of family history. And then once you move into stage B, now you have some sort of structural heart disease, but no signs or real symptoms of heart failure. And that's when you have actual drug therapies that come into play, including things like ACE inhibitors. ACE inhibitors work by reducing blood pressure and dilating blood vessels. Then as you move from stage B to stage C, now you have actual development of heart failure symptoms. That's when you add something like beta blockers in, and those help to reduce blood pressure by blocking adrenaline in the body. Finally, once you have actual serious symptoms of heart failure, now you have a whole bunch of different treatment options and goals and outcomes that are associated with that. Just a couple of definitions now if we're going to talk about problems associated with drugs. One of those is drug abuse. Drug abuse is using drugs specifically for their intoxicating effects. Drug misuse is slightly different. Drug misuse is just using drugs in the incorrect intended format or way. Example of that would be using antibiotics to try and treat viruses. Also, not continuing a complete course of antibiotics as well. Both of those two things have led to an increase in antibiotic-resistant bacterial problems. Another definition is placebo effect. Placebo effect is when you have you're administering an inactive substance but still seeing effect, where you're still seeing some positive results even when they're administered a placebo. We're going to talk a little bit more about psychotropic drugs. Psychotropic drugs are drugs that affect the human mind. There's three main categories of psychotropic drugs: stimulants, depressants, and hallucinogenic drugs. Stimulants include things like cocaine, amphetamines. These will increase alertness, increase mental processing, make people feel good. You have depressants like alcohol, anesthetics, barbiturates. These reduce consciousness. And then hallucinogenic drugs, these are things like LSD and marijuana. Those will alter the way that we perceive reality. A little bit of chemistry of the nervous system. The nervous system is made up of about 12 billion neurons. Picture here is what a neuron looks like. Essentially, the neuron is a long cell where you have, at the top, you have dendrites. Dendrites receive incoming chemical information, and they'll convert that into an electrical signal that'll travel down the neuron to the end of the neuron where you have the synapse, and it will communicate chemically with other neural cells. The way that the two different cells will communicate is through chemical compounds called neurotransmitters. Neurotransmitters are released through the synapse from one cell to another in order to communicate. Drugs will work by affecting the way that those two cells communicate with each other. One drug, LSD, is a psychedelic drug. LSD is an interesting drug. Out of all the drugs that are abused by humans, LSD is the one drug that animals will not take willingly. You can teach an animal to take cocaine, to take alcohol, to take THC, but animals will not willingly consume LSD. Other types of hallucinogenic drugs include psilocybin and mescaline, and also marijuana. Getting back to those neurotransmitters, epinephrine is something that's secreted in the body. It's linked to the fight or flight syndrome, so it's released and it will cause increase in blood pressure, increase in heart rate, increase in breathing. Epinephrine has been linked to anxiety and depression. Norepinephrine is a neurotransmitter that's a relative of epinephrine. When it's released in the brain, it's associated with feelings of elation. If you have too much of it, it can lead to mania, and not enough of it can lead to depression. Norepinephrine compounds, drugs targeting norepinephrine can come in two different categories. Those are agonists and antagonists. Norepinephrine agonists will stimulate and mimic the effects of norepinephrine in the brain. They're often used to treat depression and anxiety and obsessive compulsive disorder. Antagonists will block the effects of norepinephrine in the brain, and those actually, not only in the brain but also in the body, and those are actually used widely for the treatment of heart problems. Another neurotransmitter is serotonin. It's involved in the regulation of body temperature, in sleep, in sensory and pleasure perception. A lot of research out there suggests that reduced amounts of serotonin in the brain can be associated with depression. One drug that's targeting serotonin are selective serotonin reuptake inhibitors, or SSRIs. They enhance the effect of serotonin by blocking the removal of serotonin from those synapses that I mentioned before. Anesthetics are another type of drug that can cause lack of feeling or awareness. You can have general anesthetics that will work all throughout the body, and local anesthetics that will work in just specific areas. General anesthetics will act on the brain to produce unconscious and insensitivity to pain. Chloroform is one that isn't used as much anymore because the range of effective dose and lethal dose was very small. It also causes liver damage. Local anesthetics are used to render a part of the body to be insensitive to pain. They actually work by blocking nerve conduction and reducing the permeability of the nerve cell to different ions. So basically they just dull the cell itself. This allows the patient to stay conscious during things like dental work or minor surgery. Barbiturates are another type of anesthetic. They are related to depressants. They were once used as sedatives. In large doses, they induce sleep, but they are very toxic as well. Alcohol and barbiturates are both depressants. Taken together, they have a synergistic effect. Synergistic effects basically mean the effect of them combined is greater than either of them taken separately. So, for example, the depressant effect of a barbiturate is enhanced about 200 times when taken with alcohol. Anti-anxiety agents include things like benzodiazepines. They work on a neurotransmitter that is called GABA in the brain. Stimulant drugs are another type of drugs. There are plant-derived and also synthetic stimulant drugs. Stimulant drugs include things like amphetamines. Amphetamines are used a lot to treat depression and narcolepsy. They increase pulse rate and blood pressure. They can help make you excitable and also restless. At one time, they were also used as a diet drug. In some cases, they actually seem to reduce excitability and restlessness, which is why amphetamines are used to treat ADD in children. Cocaine is a powerful stimulant. It's now widely available also as freebase crack cocaine. It acts by preventing the brain from taking in a neurotransmitter called dopamine, which leaves high levels of dopamine in the brain to stimulate pleasure centers of the brain. Its effect is relatively short-lived and is often associated with depression and craving for more. Other types of stimulants include things like caffeine. Caffeine is a mild stimulant. Effective dose of caffeine is about 200 milligrams. Nicotine is also a stimulant drug. You can take nicotine by smoking or chewing tobacco. Initially has a stimulant response, but then is typically associated with a depression after. One of the things that's really interesting about nicotine is smokers are able to maintain a near constant level of nicotine in their bloodstream. It's like they know exactly when they need to have a cigarette to up their nicotine blood levels. The final slide is just looking at three of those neurotransmitters that I mentioned a little bit: norepinephrine, serotonin, and dopamine. And then it looks at the main roles of those neurotransmitters. You can see dopamine being reward and motivation, norepinephrine being alertness, concentration, and energy, and serotonin being obsession, compulsion, and memory. And then it looks at the overlap of those two and how they can influence each other. So you can look at the overlap of norepinephrine and serotonin, having roles in anxiety, impulse, and inhibition, the overlap of dopamine and norepinephrine playing a role in attention, the overlap of all three playing roles in mood and cognitive function. So the point of this slide is really just to say that the brain and the neurotransmitters in the brain are very complex, and we don't quite know exactly how they all work together and how to best target all of the different needs that people might have in order to balance them out. But there's a lot of work being done in that area.